For me, it's about my son.
I occasionally will start talking about.
I guess one of the things I'm holding on
For
to.
me, for a while, I
The
stopped.
medical assistant was waiting.
Chronic illness.
I'm not the best.
You're about to meet a group of explorers, discoverers, cancer patients who have chosen to take a path less known, and in the process pay it forward as participants in clinical trials.
I'm taking care of Gary, all right, as best I can. But in so doing, I'm also taking care of Chad and Courtney. Those are the two boys. And I'm taking care of maybe a whole lot of other folks out there too.
Well, I like that attitude that you're doing something for your sons or really anybody down the line.
6 candid voices, patients and their caregivers in conversation about choosing to join a clinical trial, the expectations, the realities, and the challenges ahead.
It really doesn't matter to me as long as I'm alive. I have a 14-year-old now. I'll take whatever poison you're gonna give me. I don't care what form it comes in. As long as it keeps me here another day for my son, let's do it.
I had a little bit of trepidation about it because of, not thinking that it was an experiment type of thing, but it seemed to be working for her, so I'm very optimistic about it at this point.
Prostate cancer, had the prostate taken out, good for 2 years, then it came back, radiation, et cetera, et cetera. So then I came down to Johns Hopkins to try and find out what the options were. They did say that day, but we do have some possibilities of some clinical trials.
I knew he was going to say, this is what we're going to do.
It was just, okay, we're trying this, so now, and that didn't work, so let's try that. And I'm going, okay, hey, that's fine, whatever you need to do, I'm game.
My only thing was, you get the placebo or not and all these things. And my thing was, I want to know what he's getting. But he was okay with not knowing.
In terms of the decision-making process, I didn't find it that hard either because it's like, what do you have to lose, really? I mean, I guess I have confidence that if it was the experimental drug was really killing me, they'd take me off it and give me something to get back on track. But so I don't find it that difficult a decision to make.
They don't scare me at all. Anything that, like you said, that buys time, because they're making so much progress. So I was elated when they came up with this immunotherapy.
Once I take my pill, the whole issue of prostate cancer is gone. And I go and do whatever it is Mona has me doing that day. There's no fear. I think it's great. I know that what I'm going through, they'll be able to use some of the data from me, and we have 2 sons. Years down the road, there may be something that I've done for them, and for others too, that's going to help them not have to deal with this.
To me, that's a motivator to think that I'm paying it forward, because I know that men, 5-10 years ago, were in trials that are helping me today.
Just the 3 of you in this room and how much knowledge has been gained by just 3 people, with these trials.
I don't know where I would be if I had not taken, said yes to the clinical trial. I know if I hadn't gotten the PSA originally, the whatever I had in my prostate would have just really stayed there, just spread entirely throughout my body. At least we got as much as we could out. It's still metastasized somewhat, but we're managing it, we're controlling it. So I feel good about where I am today, given the circumstances and given the treatment that that's been made available to me and that I've received.
So the order in which these therapies are applied is important, and I was actually in a study in which they tried to determine what order to apply them.
Sometimes if you jump ahead to number 3, and number 1 or number 2 may have helped you, but you've jumped ahead and now those aren't options. You want to keep as many options open as possible.
What about those quiet times for you? Like, where you're not being a researcher and you're worried or whatever. Like, what do you do to get through?
The staff here that work on the Cancer Center, I love them all. Underline that in quotes. They appear to be so personable and so emotional and so caring. They're professionals, but I like to come here because I get to see, I get to see these folks because they make me feel good.
I went to another hospital in Philadelphia, and it wasn't like that at all. It was much more like walking into a doctor's office for the very first time, every time.
For me, it feels like family. It's a very crazy way. I'm so glad that you guys are saying the same thing because it's just not me. It's a very surreal feeling to walk into this building and you know that you're coming here for chemo, but when I walk in the building, I don't feel like, oh God, I'm here for chemo. I feel like, where are my friends, Even like with my mom, I'm always hiding from her in the building because I don't always want her at my appointments. They'll help her find me.
Her. And she had a scan coming up that, I really wanted to know what was going on. She didn't call, she didn't text. So I started looking for her. The medical assistant was waiting. Oh, you're Trina's mom. Yeah, she's right back here. I knocked on the door, and she was sitting up on the table like she was expecting me. She said, oh, hi, Mommy. I said, hello.
When we come in, the conversations pick up right where they left off the last time that we were here.
Last week when we were here, I walked into the examination room, and there was a nurse practitioner and 2 nurses who I knew. It's really nice to see familiar faces.
It is.
What about those quiet times for you? Like, where you're not being a researcher and you're worried or whatever. Like, what do you do to get
I want him to live. So I'm going to push for anything, but he's the one that has to be in the body and dealing with it. And so I told him, you know where I stand, but it has to be your decision. You have to make some time for yourself too, to take care of yourself as the caregiver.
For me, for a while I stuck my head in the sand because it was easy.
Knowing that your child is going through something that you have absolutely no control over is very overwhelming. It is like mind-boggling, and it's like you're having a talk inside of your head. It's like, what can I do? There's nothing you can do. Yeah, but it's got to be something. So I'm researching all this stuff, and sometimes I really just want to have a temper tantrum about it. There's nothing I can do with it. So over the last 4 years, I've learned how to make it be a part of my life. You just kind of learn how to just keep it all in control and in its proper perspective, if there is really a perspective for cancer. I really just want cancer to just go away. Just go away.
What about those quiet times for you? Like, where you're not being a researcher and you're worried or whatever. Like, what do you do to get
I've thought about the future, but right now I'm living today.
I tell him he'll be on his 3rd wife. I'll be long gone. He's gonna have 2 more wives. So
I'll be, I'm living today.
yeah.
And I thank God for today. You said pay it forward. So there is something that I'm doing that's good, that's coming out of this that's bad. But I'm not worrying about the bad.
What about those quiet times for you? Like, where you're not being a researcher and you're worried or whatever. Like, what do you do to get
No, we haven't had that conversation. All right, I'm where I am. At a point in time, my numbers will start to go up. And I understand that there are probably somewhere between 5 and 8 other things that we can get to before before it gets bad. So we're going to delay the conversation until we work through these. That's where I am with it. But we'll deal with it when it's time to deal with it. Right now is not the time. That's my take. Mona?
Oh, I totally agree. totally.
Now, Trina and I have had that conversation. You know, she's talked about, you know, what I'm going to do at my house. She's talked about don't put any funny looking makeup on her when she's laying in her casket, told us what she wanted to be buried in, and all of that. And those, I mean, how do you sit there and listen to your daughter talking to you about when she dies?
Yeah, I did have that conversation. I probably won't ever have it again, you know, because it changed. It changed. So in my mind, yeah, it's planned right there, you know, but that's the control freak in me. It's not the, oh my God, I'm gonna die.
Yeah.
It's the, I want to look a certain way, and I want it to be a certain way, and I want it to be a party. I don't, you know, I want it to celebrate my life, you know, but it's not that, oh God, if this clinical trial doesn't work, you know, Mom, we need to really have this hard conversation. It's never that. It's always more so, I don't want you to worry about that.
Yeah, it was a hard conversation.
Joan and I don't think we have had the conversation, and I think she knows, you know, I'd like to have a big party too, or people come and play music. I got to remember to tell you where the will is.
I've been through, you know, the toughest part of care, and it doesn't frighten me. You know, I'm there. I'm not walking out on it, and so in little ways, I try to reassure him and stimulate conversation if he's ready to talk about that.
What
And
about those quiet times for you? Like, where you're not being a researcher and you're worried or whatever. Like, what do you do? Being on a clinical trial, for me, it's nothing. You know, it takes away my time. I already know that I'm going to 9 times over be sick. I'm going to not be able to feel my feet for a couple days. It breaks down your body, but I think it just becomes your new normal. All day long, I have neuropathy in my feet. I still wear my heels. When I go to, thank you. So I really think that it's mind over matter. So it just is.
It's difficult to think about her, you know, suffering and being uncomfortable. It's a hard thing to do when you know it's somebody that you love and they're having discomfort because of the big C word. And you know, I just really just want her to be okay.
What about those quiet times for you? Like, where you're not being a researcher and you're worried or whatever. Like, what do you do? I have cancer, but I'm probably the happiest that I've ever been in my life. And I know that's kind of weird, but it's because it makes you live on purpose. It makes you be very mindful of, I love you, of, I'm not washing the dishes, I'm gonna go sit on the porch. You know, I'll get back to it. I always tell people cancer is a blessing and a curse. It's all how you look at it, because the blessing is that you know that you have it. The curse is that you know that you have it. So you're trying to fit everything in a bubble.
Yeah, I don't know if it's just from getting older or from having cancer, and I was diagnosed about 8 years ago. But I find I'm a lot less judgmental than I used to be, and I'm a lot less demanding than I used to be.
I find that more and more I come to really appreciate and sense the world and sense life. And I find so much pleasure and joy in it. I can think about these things more, and then with the cancer thrown in there, mixed in there with it, man, it's a great experience. It's a blessing, and it's a curse. Every day, every week, every month, there's something else, potentially.
Right.
You know, so we gotta hang on to that.
Right.